Well, the partnership between the pharmaceutical industry, the biopharmaceutical industry, and patient groups is an absolute necessary part of the discovery process. Our scientists can't proceed unless patients and patient advocates are involved. We need them involved for a variety of reasons. We need to understand the patient perspective of the diseases that we're trying to cure, trying to treat. We need their help in bringing to us the patients who will serve in clinical trials so that the discovery process, that very important part of the discovery process, can go on. And then we need the patient and patient advocates to participate with us once a medicine is approved so that we know how it's working, how it can be modified, what it needs to be the next generation of medicines so that we can continue to make progress meeting unmet medical needs. The patient relationship with the scientists in the biopharmaceutical industry are becoming more and more specific. As the science drives towards more and more genetically homogeneous populations, the patient advocates, the patient groups, and the scientists have to work together to make sure that we're getting the right patients into the trials, the right perspective from those patients, because the great promise of the medicines and the great promise of the science is it's going to be tailored for individual populations. And so it's going to be more robust, it's going to be more complicated, and it's going to be more intimate as the science progresses. Well, one of the things that industry and the patient community and NHC have done has been to work together, and I particularly really applaud NHC for the leadership in the input for the 21st Century Cures proposal that Chairman Upton is moving forward. This is a patient-centric process, and the kinds of input that were given to the committee and to the chairman as they were drafting this legislation were absolutely essential about how can we work together to speed up, to expedite the regulatory process. What are the new regulatory sciences that we need to develop so that we not only know more about how to target medicines, but we can do it in a more expeditious way? That patient advocacy voice is the most powerful. That's the reason we're all doing this, to serve patients, and nothing is more important than the patient's voice in telling policymakers how to make it better, how to make it faster, how to make it more effective for treating the unmet medical needs.